One of the messages that we've been, seeing in our clinical trials over the past 2 to 3 years is this move from, three drug to four drug combinations, especially incorporating anti-CD38 monoclonal antibodies to the frontline setting. And this ASCO and EHA saw, even more data in support of that, better depth of response, better PFS benefit, even for older patients, the IMROS trial, the benefit trials, read out kind of supporting that notion. So there are two, things to consider. If you're going to utilize quadruplet regimens for all myeloma patients, you're probably going to utilize them as part of their initial induction therapy. The question about maintenance treatment, which patients to pick to give two drug maintenance versus one drug maintenance, that's still something that we're figuring out. So, however, so having said that, there are going to be patients, who got an anti-CD38 exposure 2 or 3 or 4 or 5 years ago, in which, you're comfortable utilizing an anti-CD38 as part of a triplet. And then there are going to be patients who are getting anti-CD38s as part of their maintenance strategy. The proposition for those patients is going to be different. We are going to have to pick non-anti-CD38 based, monoclonal antibody based combinations for those. And there's some, exciting data, with some BCMA directed strategies that's coming, for that particular scenario.